Hey everybody, Lauren Breeden, speech language pathologist here again. Today I'm going to be talking to you about trauma-informed speech therapy. So trauma-informed speech therapy is not something I learned about in graduate school at all. I think trauma-informed care, that term has become much more widely known since we have all gone through COVID. But the trauma that I'm speaking about is not necessarily just the trauma experienced through COVID, but primarily for children in the foster care system, or even kids that have been adopted out of foster care, or kids that have been adopted from other countries. So the trauma that I'm mostly speaking about, it's not limited to this, but abuse, neglect, mistreatment, malnourishment, those types of things. So of course, the word trauma is a very broad word, right? And so it can mean, of course, abuse, neglect, and those also have different subtypes like sexual abuse or emotional abuse or verbal abuse, things like that. But then it can also be just traumatic experiences that only happen like one time, such as moving from state to state, or even in some instances, I have had families in my career in early intervention where they go to a different country and spend several months in the other country with other family members apart from their parents. And they come back to the States several months later, and it seems that they have completely gone backwards in their development. So that could be trauma. It could just be, an adjustment period. It could be, divorce could also be a cause of trauma as well. So when we're looking at children who are birth to 3, trauma can happen. And we have to remember that they are still just little people. They have very immature emotional systems. And so when they experience a traumatic event, whether it's a one-time traumatic event or it occurs multiple times, their little systems don't know how to deal with that trauma. They don't know how to react to it. They don't know how to respond to it. And they especially don't know how to heal from it on their own, okay? And honestly, this can even go into infants, okay? So trauma could have even occurred in the womb, whether the mother did not get any prenatal care, or she was using drugs or drinking alcohol while she was pregnant, or even if the mom was under a lot of stress when she was pregnant. So all of those things can have an impact on a child's development. And we have to be, as trauma-informed speech pathologists, we have to be aware of these things because, and here's a big reason why. It can be difficult to differentiate between a child with negative behaviors that's just acting out, to act out, to get attention, whatever, and a child with negative behaviors because they don't know how to cope, but they look the same. And so that's why it's important to, you always need to do a thorough case history with these kids and make sure that you know where they're coming from, especially if these are foster kids. Unfortunately, most of the time, children that come into foster care, we don't know their history. Sometimes they have been tested for drugs, and so we may know a little bit about that. But most of the time, we don't have a completely clear picture for those foster kids. Okay, so you may be wondering, well, Lauren, what makes you so qualified to talk about trauma-based or trauma-informed speech therapy? I was a foster parent. My husband and I were foster parents for 6 or 7 years. So the majority of that time, we only had young kids because that's what I was comfortable with. And so we had a 4-year-old, a 2-year-old, a 6-month-old, a 3-year-old. So basically, birth to 3, birth to 4, we had it covered with our experience in the foster care system. And honestly, that's where I learned most of this stuff, not just from being a foster parent, but also through the trainings that our agency put us through in order to become licensed as foster parents. So that's really where my experience comes from. I always try to even teach my own biological kids when they encounter those bad kids, to them, that's how they see it, right? Those bad kids in the classroom that are disruptive, unruly, don't listen, they're violent sometimes. These may be the kids that hit their teachers, that bite others, that, pick up a water bottle and chunk it across the room. I always try to remind my own biological kids, you don't know what they face when they go home at the end of the day. True, they may have an emotional imbalance. Maybe they do need medication, for a mental disorder or something like that. But my dog is right outside my door. But what I find is that for the most part, kids are only going to act in response to their environment. So when we talk about trauma-informed speech therapy, especially, and this is mostly for the early childhood intervention setting, okay? And it may go even beyond that as well, but I always try to look past the behavior in a child and to try to get down to the reason for it, because children are just responding the way that they know to respond, okay? Going back to what we learned in graduate school, about fight, flight, or freeze, okay? And we have to think about those responses. So for some of these kids, it may look like a fight. It may look like a flight. They may, go out of the classroom and pew, they're gone, Or these may be the kids that just completely shut down and you can't get anything out of them. And it seems like they're just being belligerent, or they won't listen, or they won't follow directions, when really you have no idea what kind of emotional turmoil they're dealing with on the inside, and they don't know how to handle it. So let me give you just a little bit of an example. The first time that I ever experienced this in ECI, this was before we were even foster parents. So we had a little foster boy. He was, I don't even think he was 2 years old. He was maybe like 19, 20 months old, okay? Very skinny. It was obvious that he had been malnourished. He had been with his current foster family for about a week. So foster mom really didn't know much about him either. She didn't have any, medical information on him. She had no developmental information on him. And that's very common as a foster parent. You're just basically like, here you go. Here's your foster kid. We think his birthday is on this day, but I don't know. And we're pretty sure his name is XYZ, but maybe mom was lying, because they do that. Okay. So for this kiddo in particular, he's brought into, this is when we were doing evaluations in her office, and she brings him into the office, and he sat in her lap the entire time and did not move. And when I say did not move, I mean, he didn't look at us. He didn't make a sound. He didn't look around the room. He just basically sat in her lap, curled up, wasn't even really snuggling with her either, though. And he was like that the entire evaluation. And so we're trying to do the developmental assessment of young children. And thankfully, we were using that assessment at the time because we were able to get her input. It wasn't something like the Patel Developmental Inventory where everything was structured, because he scored very, very low because he didn't respond. And I pick him up on my caseload for therapy. Obviously, this kiddo, he needs a lot of help. And I would be lying if I told you that we made a whole lot of progress in speech therapy, because this child was so broken from whatever environment he had come from. His little system was just focusing on healing, attachment, and really just trying to regulate whatever emotions he was feeling inside. So most of our visits were pretty much foster mom sitting in the recliner, and he would sit with her, and he would sit with her the entire time. And unfortunately, I didn't get to keep him on my caseload for that long, but that was the most emotional and sad case of neglect that I've ever seen in a toddler. I have also experienced toddlers that you go into the classroom or you go into the home, and these are the kids that are pulling out all the toys and dumping them on the floor and then running away, or they're hitting other kids, or they're pushing other kids, or they're taking toys and making other kids cry, and the teachers are completely overwhelmed and they don't know what to do, and they think that this child is just a trouble. This child is just a nuisance. So that's really where being an ECI SLP can come into play, because we can take an objective viewpoint on this child's behavior and think about where that child is coming from and meet them where they're at, and then work our way up the staircase to appropriate development. Okay. So one of the principles that we learned in our foster care training was the Tbri method, which is the trust-based relational intervention. And this is a research-backed program that was developed by Karen Purvis. And unfortunately, Karen Purvis passed away several years ago from breast cancer, but her legacy is still there, and the research is solid. And so I am going to share a link to one of the articles on TBRI with you. But essentially what it does, the basic principles of it are giving simple choices by holding out two fingers. So, okay, Alex, do you need help cleaning up, or can you do it by yourself? And it may seem kind of silly to do that with a child that's 2, 2.5, even close to 3. But it helps. And I use those choices, and I always told parents, choices between 2 desired outcomes. Either way, those toys are getting cleaned up, but can you do it by yourself, or do you need me to help you? And in some cases, that child's not going to respond verbally, okay? And if they don't, after you repeat that question a couple times, like, okay, I'm going to help you clean up. Let's clean up. And you're going to have to decrease that expectation. So don't give them 20 blocks and tell him to clean up all those blocks. No, you clean up 95% of those blocks, and then little Alex will put in the last 2 or 3, okay? Because these children have never experienced success. And it's up to us, in some cases, to teach them that they can be successful. They can do this. They may need a little bit of help, but they can do this. So that's one of the things that I carried over from TBRI into my speech therapy. I also carried in the principle of trust, because as a small business owner as well, people will only buy from people that they know, like, and trust. And if somebody doesn't trust you, well, why would they listen to you? And it's the same for kids too. Kids don't care about how much you know. They don't care how many years you went to college. They don't care even about what toys are in your bag, or what stickers you have today, or that you have bubbles or whatever. They don't care about that if they don't trust you. So how do we build trust? For children, I think that we build trust by being consistent. We build trust by creating little mini routines within our sessions. And we build trust by meeting them where they are, and then very slowly increasing the expectations. And so just go back to my blocks example of cleaning up blocks. As far as creating a mini routine inside your sessions, this is kind of what it used to look like for my kiddos. Okay, so when I was still going into daycares, I would go into daycares. You know, I tried not to pull the kid out of the classroom, if at all possible, especially before COVID. If at all possible, I would just find a corner in the room, or maybe a table that wasn't being used or something like that. Because I didn't need a ton of space, right? I just needed kind of a quiet little spot, a quiet corner to sit myself down with this kiddo and try to do something. And so, yes, that meant for me, I would have to bring in some of my own things, simple things, stickers from the Dollar Tree, bubbles from the Dollar Tree, okay, some crayons, you know, just simple things that could be easily replicated at home. And then I would also try to, you know, pull a couple things from the classroom as well, if the teacher was okay with that, maybe a puzzle or a board book or something like that. So that way that child has options, but they only get 2 options at a time, because if you give a child 5 different options, especially a toddler, that's overwhelming. That's too much. It's way too much. You can even decrease it even more. Let's just take stickers, for example. Okay, Johnny, do you want 1 sticker or 2 stickers? Or do you want this one or that one? And make it super simple, okay? Because these kids are probably going to be your kids that get overwhelmed very easily. These may be your kids that have sensory processing disorder, just because their systems are so damaged by neglect or abuse. So in most cases as well, to help provide some security, these were the kids that I would sit down on the floor, because that's what we do in ECI. We're always sitting on the floor, and I would plop that kiddo in my lap. I may put some downward pressure on their shoulders. I may give them, you know, little squeezes on their arms if they seem a little bit agitated. And one good way that you can tell if they're too excited, or if they're, you know, kind of hyperactive, that's pretty easy to see, right? Because these are your kids that are going to be running around the table. These are your kids that are going to be dumping toys out and running across the room or something like that. But there are also times when kids are just stressed out. And how do you tell that a kid is stressed out? Put your hand on their chest. See how fast their heart is beating. One of the harder things for us to do as speech pathologists, as people, really, is to not match that emotion. So if little Johnny's heart is racing when you walk into that daycare center, or if that child's heart is racing when you walk into the home for the first time, and I'm not saying you do this on the first time necessarily, but just check, you know, just a gentle touch, especially if their heart's racing. It's not going to take a deep pressure touch to feel how fast their heart is racing, okay? But that will give you a good measure of where that kid is at. So for my kids that need more of that input, sitting in my lap is a great place to do that. I can give them a hug, that pressure on their shoulders, squeezes on their arms. And then it's also easier for me to also just provide that pressure on the side of their body with my arms to keep them stable, keep them focused. And you may still only be able to get 3 to 5 minutes at a time before little Johnny needs a break and he needs to run around the tables again. Okay. We're not looking for perfection here. We're just looking for progress. For these kiddos especially, it's really important that you try to establish that mini routine. So for me, I'd walk into the room, I'd wash my hands, I would, you know, maybe open my computer, get my notes started, put my computer away, and then I would get a couple things out of my bag, and then I would pull the kiddo over to me, work with them for maybe 20 minutes, then we were all done. They could go play, or they could take a break. And I would come back on the same day next week, the same time next week. And I promise you, after you're consistent for a couple of weeks, these kids learn. Not only do they learn about routines, but they thrive on routines. And I honestly recommend that so often, even if the kiddo isn't going to daycare, if they are just staying at home all day. Okay, foster mama, you have to have a routine down. Even if, you like sleeping in on such and such day, you may have to get up early because that kid's going to be an early riser, whether you are or not. You have to have breakfast at this time. You have to offer snack at this time and such and such. So routines are so important for all kids, but especially for kids that come from broken environments. Okay. So don't forget about that. Try to be consistent in whatever you're offering for the kiddo, because they will come to expect it. And then you can grow off of that as far as, your speech and language goals go. But kids have to know that they are safe with you, that you can offer a safe place for them to just be who they are. But you can also offer that structure that they need in order to thrive, because most of the time they don't come from structured environments. And so they really, really benefit from that. So that's a very general synopsis on kids with from trauma backgrounds. You can find a lot of things on Google about trauma-informed care. Most of it is for physicians. And so that's why I wanted to do this video, because there's not a lot of information out there on how we can do our job as a speech pathologist with these kids who come from hard places. So I have a couple articles for you. One of them is on the Tbri method. I really highly encourage you to read over that. There's also another one from the Asha Wire journal. And then there is one from the informedslp.com that is also pretty good as well. So I hope this was helpful for you. If you have any other ideas on topics to cover, or if you think, you want me to go a little bit deeper on this about the kind of therapy that I've done for kiddos that come from hard places, feel free to drop me a comment below. Don't forget to like and subscribe. And also please consider checking out my Patreon page if you would like to keep this free information going. Thanks so much.